From the classroom to the emergency room, OR, and beyond, you're joining Trauma ICU Rounds with your host, Dr. Dennis Kim.
Welcome to Trauma ICU Rounds. I'm your host, Dr. Dennis Kim. I'm an associate professor of clinical surgery at the David Geffen School of Medicine at UCLA and a trauma surgeon intensivist at Harbor UCLA Medical Center in South Los Angeles. I gotta say, I am really looking forward to our upcoming season 2 of Trauma ICU Rounds, the theme of which is acute care surgery. Over the course of about 30 or so episodes, we're going to explore controversies and discuss management strategies for commonly encountered emergency general surgery conditions. This is going to include things like bowel obstruction, how to manage a patient with mesenteric ischemia, how to perform a resuscitative thoracotomy, and more. In this season, we are featuring an incredible lineup of guest professors who will be joining us on rounds to share the results of recent research findings as well as their clinical expertise. Locally, we've got Dr. Eric Sims, Christian DiVirgilio, Shirin Tofai, Ronnie Sullins, as well as Kenji Inaba. And from around the country, Drs. Matt Martin, Vanessa Ho, Martin Zielinski, Walt Biffle, Jamie Coleman, and Dr. Sharmila Disanaki. We're also collaborating and working with a number of other shows, including Dr. Scott Weingart at MCRIT, Dr. Joe DuBose at Tiger Country, love the title of that podcast, and Melissa Red Hoffman at Surgical Palliative Care Podcast. And just last night, we recorded an awesome episode in which I learned a ton with Dr. Joel Topf, aka Kidney Boy, who many of you know as an online and social media savant. He's absolutely incredible, was a wonderful guest, and we're really looking forward to that episode coming out in just a couple of weeks. I want to thank you for joining us on Rounds. If you've got any feedback for us, positive or negative, why don't you send that to me via Gmail at traumaicurounds@gmail.com. Alternatively, please feel free to DM me on Twitter. If you're not on Twitter, you should be, and you can find me at Trauma ICU Rounds. And if you have any suggestions or feel like there are certain content experts out there that we should be interviewing, please let me know about that as well. Until next time, please stay safe, continue to read, take care of each other and yourselves. Looking forward to the launch of Season 2 this week.